Thank you, Wayne, very much, and thank you to DCHC for hosting me. And very impressive what I saw in our tour just a few minutes ago. Good people too. I could see that. My belief is that our healthcare system is in crisis. We have at least 45 million people in this country who don't have healthcare coverage. We have millions more who are terrified about losing their coverage. Health insurance premiums are up at least 90% over the course of the last 6 years. A few months ago, in February, I announced a healthcare plan, a truly universal healthcare plan, very specific universal healthcare plan to cover every man, woman, and child in this country. Required by law that every man, woman, and child in America be covered. I was the first candidate, Democrat or Republican, to do that. I'm proud of having done it. But as I said at that time, healthcare is about, and dealing with the healthcare crisis is about more than just coverage. Our healthcare system is entirely too expensive. We put more money into healthcare than any country in the industrialized world. We get one of the worst products out the other end. Here in Detroit, healthcare costs are absolutely crippling for businesses. GM, Ford, and Chrysler spend a total of $16 billion a year on healthcare costs, as everyone in Detroit already knows, and they're looking at $114 billion in future retiree benefits. And these companies and their unions made a promise to workers, and that promise was that they would have health care coverage. And now it's time for the government to meet its share of the responsibility in ensuring that those promises are met. We can do better than we're doing now, but we have to be focused and we have to have very specific ideas about how to do it. So I want to talk now about my specific plan, not just to provide coverage, which I've already talked about over the last few months, but to reduce costs in the healthcare system. And it's done by taking on insurance and drug companies and improving the quality and efficiency of our healthcare system. The plan that I'm about to go through will save an average family $2,000 to $2,500 a year, and it'll cut waste in the healthcare system by $130 billion. So we're going to start with what we need to do to reform the insurance industry. What we're going to do is set up health markets around the country. In those health markets, insurance companies first will have to compete with each other in a way that they don't compete today. And second, they'll have to compete with a government plan, which is essentially Medicare Plus. And the effect of that competition will be to create more efficiency and reduce costs for everybody. And instead of plowing higher premiums into higher profits, we're going to require that these insurance companies spend a higher percentage on actual patient care. I mean, today it's about $3 on every 10, about 30% goes to administrative costs and profits. And we're going to require that 85% of the money that's going from insurance companies actually goes to patient care, not to administrative costs, and profits. And we're going to require that insurance companies be truthful and forthcoming about their policies or when they send a bill. So the first place is taking on insurance companies and insurance company reform, and specifically reducing the amount of insurance company dollars that are going to administrative costs and to profits. The second big area is to make prescription drugs more affordable. What we know is that this is one of the biggest barriers to basic health care for most of our families, that drug companies, big pharmaceutical companies, are spending about twice as much on marketing, these ads you see on television, as they are on research and development. I've always enjoyed their ads. It's like if you buy their medicine and take it, next day you'll be skipping through the field with your wife holding hands. And I think what we want to make sure that patients are getting the prescription drugs that they need. And the starting place here is improving and changing the patent system. Basically, what I'm saying is that we should exchange for the right to have a patent on particular breakthrough drugs on particular diseases, things like Alzheimer's, cancer, that instead of the company having a long-term patent on that drug, will have a cash prize available to them on the front end so that they have an incentive to do the work, to do the research, to do the development, but we get it on the market quicker and it can be made available at a generic price, at a lower price, and more comprehensively. So basically, it deals with the concerns that drug companies have about why do we invest in this if we're not going to have a patent that's going to protect us by putting a cash amount up front. And in these areas that are so important, like Alzheimer's and cancer. And we'll have a panel of experts, by the way, who identify the specific diseases this applies to. We're going to give them cash up front, and it'll become, as a result, a generic drug that's available to everybody at much lower cost. And we also need to reform the FDA's procedures so that we give the FDA the authority to approve safe generics for new, complex, and expensive biologic drugs. The third big area is changing the treatment of chronic disease and providing preventive care. Chronic diseases are actually the top driver of skyrocketing healthcare costs, and this is striking. They account for 3/4 of our nation's healthcare spending. We have to get in front of this problem. As president, what I'm going to propose is a bold new approach to chronic care that will create savings to the entire healthcare system. Number one, we're going to require chronic care management. In other words, everybody will have a medical home. There'll be a person who's a doctor who's in charge of coordinating medical care for patients with chronic problems and making sure that they get the care that they need, that it's not overlapping, that it's efficient, but it's effective for the problems that they have. And we're also going to prevent the waste that exists today, specifically with respect to drugs and doctors who repeat many of the same tests. That's what this medical home will do. And not only is chronic care covered, it's required in this health care plan that I have proposed, so that we make sure that everybody gets preventive care, and if you have a chronic disease, long-term chronic care, so that we don't get to the place where a chronic health care condition results in a catastrophic problem that's extraordinarily expensive. So that's preventive care and chronic care. We also want to improve the availability of technology and the use of best practices. Today, less than 1/4 of hospitals and 1/5 of doctors' offices have health information technology systems. So we want to make sure electronic medical records are used and are available so that we don't have some of the problems that we've had in the past with bad records resulting in bad care. And we want to build out an IT infrastructure that'll allow better and more efficient treatments for the patients who are being treated. And we want to encourage the use of the best practices in evidence-based medicine. And so this system this entire healthcare system plan that I've proposed does that. It sets up a mechanism for evaluating both the drugs and the treatments that are being used around the country to see what's creating the best results. Which drugs are the best for a particular health problem, which treatments have turned out to be most effective, so that they are coordinated and the best practices and the best treatment is being used. I mean, one of the problems we have today is the kind of care and the quality of the care you get seems to be influenced by the zip code that you live in. And what we want is we want the best quality care that's available in America to be available everywhere in America. The most efficient, most effective, and the most cost effective. And then finally, just to improve on the healthcare infrastructure, we have a huge nursing shortage in America, which anybody in the healthcare profession is fully aware of. And we want to recruit another 100,000 nurses. There are a variety of mechanisms for accomplishing that, but for those people who are willing to go in the nursing profession and go to underserved areas, we provide financial help for them to go to nursing school. Yeah, my healthcare people care about that. We also want to improve our long-term care system so that seniors, and particularly seniors with disabilities, get the care that they need and have the choice of living independently. And then the final point is we want to use technology so that telemedicine is available in areas around the country that may not have access to places like university-based healthcare systems, so that people have access to the best healthcare that's available. So that's it. I didn't mention this because I've talked about it in the past, and I don't want to repeat something that the media already knows, but But my health care plan costs, as I proposed it back in February, $90 to $120 billion a year, and the bulk of it is paid for by eliminating President Bush's tax cuts for people who make over $200,000 a year. So